Hello, this is Dr. Anuradha, Founder Director, GeneTech. In this video, let's try to understand the genetic basis of infertility and how we can use the latest genomic technology to be able to fight infertility. Infertility is a huge problem today. Around 12 to 14% of couples today worldwide face infertility problem. The magnitude is quite huge, and the reasons for infertility are many. It can include physical abnormalities of female or male reproductive physical features, or it can be due to other factors such as infection, lifestyle, late maternal age and paternal age. So there are many reasons for infertility. However, the genetic basis of infertility is quite large. A large percentage of infertility problems are because of genetic reason. However, and of course, it becomes extremely frustrating for both patients, family and also doctors to see repeated failures of IVF procedures and doctors trying every way to increase the success. But as of today, worldwide, the success rate of IVF or ART procedures, which is artificial reproductive technology procedures, is around 40 to 60%, average at around 50%. So 50% or more couples return back disappointed and not able to fight infertility. So in this scenario, if we look at the large genetic basis that I mentioned, there are a very few genetic tests that are available today to understand the genetic basis of infertility. The most common test that we use is karyotyping, chromosomal analysis of both husband and wife, to see if there are any chromosomal problems which result in infertility. Now, what kind of problems can these chromosomes cause? We all know that there are 46 chromosomes in our cells, and every chromosome is nothing but condensed form of DNA in which there are thousands of genes. Now, in some people, what happens is that there is an exchange of chromosomal material between one chromosome and the other. This condition is called as balanced translocation. So, for example, a part of chromosome number 1 can move to chromosome number 4, and a part of chromosome number 4 can move to chromosome number 1. But all the genetic material is within the cell. Therefore, the person will be totally normal, but they will be having infertility problem because such an exchange of genetic material or chromosomal material results in non-production of gametes, which are gametes are nothing but sperm and egg. So the production of sperm or egg can be disrupted, or sometimes they can be defective, and it can give rise to children with genetic abnormalities or fetal defects. So this is one of the reasons of genetic basis of infertility. But unfortunately, this particular test diagnoses only 5% of infertility genetic problems. So if you karyotype around 100 patients, only 5 patients with infertility may be having this kind of balanced translocation. Rest of the problems lie very within, in a very minute way at different genes, in very small genes that are present on these chromosomes, which cannot be identified by the technique called karyotyping. So 95% of patients come back with normal karyotype, and the doctors will see the karyotype and they are unable to diagnose the underlying root cause of infertility, especially if it is genetic. Now, GeneTech has worked from past several years. Our research team has come up with Genomic Fertility Analysis, which we call as Gene Femina for females and Gene Andro for males. The research activity included using data of infertility patients from past 24 years, and we have identified risk genotypes, which we call as risk genotypes, because infertility by itself is a condition that can affect several stages of reproductive system. For example, there may be a genetic change which can result in a gametogenesis production problem, in the sense sperm and eggs are not released properly, for example, they don't mature well, or even if they mature well, they will not be able to fertilize, or even if they fertilize, they will not be able to implant, the embryo will not be able to implant to the uterine wall well. Even if it implants, it can result in a pregnancy loss. And there are hundreds and hundreds of genes that are associated in this whole process, circle of starting from the production of egg and sperm to the pregnancy maintenance and delivery. So our research team has mined all these, the data mining was done for all these genes that affect the pathology of reproduction, and we have identified risk genotypes that are specific to Indian population. So using the data of fertility, infertility patients that we have, and we have validated, the validation of this research activity was presented in international forums such as American College of Medical Genetics, American Society of Reproductive Medicine, and several publications have been done from the organization. It basically allows 360-degree analysis of all the risks that are involved in the reproductive pathway. Also, I just wanted to tell you that this test is done, the analysis is done using next generation sequencing technology, which is the most advanced technology available today. And it not only looks at the expressing part of the genes, which are the exons, but also the non-expressing part of the genes, which are the introns. So there are several hotspots that are associated with infertility, and all of them have been put together, and it allows the doctor to look at the root cause at every level of this reproductive pathway. Now, when we talk about Gene Femina is the test that we offer for female partners to understand what's going wrong and where is the risk factor that is associated. There are several, the female could have low ovarian reserve, low AMH levels, or irregular periods, maybe PCODs, polycystic ovarian disease, or implantation failure related issues, or low number of oocytes produced during stimulation of the ovary, which we call as ovarian stimulation or controlled ovarian stimulation. One female would give 2 to 3 oocytes, whereas the other female can give 50 to 40 to 50 oocytes. So there is hyper response, there is poor response, and then even if the response is good, the quality of oocytes varies, the maturation process of the oocytes varies, and then the implantation of the embryo after the transfer in ART procedure or an IVF clinic may or may not happen. So there are several causes which are genetic in nature, and all these risk genotypes are identified. Not only these genotypes are identified, using our AI based analysis, we take lot of clinical data, we correlate with it, and then we give recommendations to the patient and to the physician. For example, we may recommend what is the best way of stimulating the ovary so that the most optimal oocyte quality and the number can be achieved based on the genotype. So this is genotype based treatment where the problem is identified and it is personalized. One person can have hyper response, one person can have poor response. Depending on their response, the treatment will be given, and sometimes some drugs work better on certain genotypes and they don't work better on certain other genotypes. So depending on the genotype specific to Indian population, what is it that we can provide to get the best quality of oocytes, and also subsequently, do you want to do sometimes people do what is called hatching of the oocyte outside the body more than the inside the ovary. This also is required for certain people who have a certain genetic problem. And implantation, some people will need heparin treatment, some people will need immunology treatment, for example intralipids have to be, IV intralipids have to be given, some people need steroids, some people require antioxidants depending to maintain the pregnancy. And therefore depending on the what risk genotype she carries, so a treatment can be given to them instead of giving all treatments at a time or a trial and error method. Evidence based treatment can be given to the female, so that the chances of pregnancy will tremendously increase because it is personalized treatment. Similarly, for males we have a test called GeneAndro, Andro for male, and here we look at several problems that are associated with fertility in male partner. For example, impaired spermatogenesis, where sperms are not produced properly, either the number is low or they don't move quickly, their motility problem, or they may have abnormal head shape or tail shape. Sometimes the sperms can look perfectly normal, but they do not have the capacity to actually penetrate the egg cover, which is we call as zona pellucida. So that results in fertilization failure. So there are several again genetic problems that are associated with sperm related issues. For example, in some men the oxidative stress in the testis is so high that there is DNA fragmentation, high DNA fragmentation in some individuals, and that also has a great genes that are associated with oxidative stress. Now once we understand the risk genotype associated with sperm related problems, we recommend with this analysis the best suitable method of treating the male partner. For example, if a male partner has a variation on FSHR gene, then we recommend treating the male patient with recombinant FSH for 2 months, which will improve the spermatogenesis drastically, and it will improve the semen parameters drastically, so that the next procedures can be followed up. Sometimes if the oxidative stress related gene is involved, antioxidants will work best in these individuals. So there are several drug related correlations based on what is the genotype that the male individual is carrying. Based on this, we provide information, and once all this information is gathered, the physician will do the clinical correlation, and they will provide personalized and evidence based treatment based on the risk genotypes that the male and the female partners carry, so that the success rate of any ART procedure can be increased drastically.